Thank you everyone who's joined so far. So this is our third webinar in the CHAMPS Wednesday webinar Fall 2020 series. And we are thrilled to be joined by Baby Friendly USA today. Ms. Trish MacEnroe and Ms. Tammy Titus. Today, our webinar is called Baby Friendly USA and the Virtual World, Innovative Assessments and More. So just a couple quick notes. This webinar will be recorded, so if you want to watch it again or you miss a little piece of it, you can always go back and view the recording, and you can chat your questions into the chat box at any time during the webinar. So first, just a couple of CHAMPS updates. We just wanted to give a quick shout out that 22 Mississippi hospitals have now been baby friendly designated, which means that 60% of births in Mississippi are in baby friendly hospitals, which is great. And we wanted to give a quick congratulations to two of the most recently designated hospitals in Mississippi, which are Ocean Springs and Gulfport Memorial. And then we also just wanted to quickly announce that CHAMPS has received new funds from the Kellogg Foundation through 2023. And in fact, our upcoming webinar on October 28th, we will be discussing some of these next steps that we will be pursuing through 2023, as well as the results of the second COVID-19 survey that CHAMPS sent out. So I think there are probably many people on this call who gave feedback through that survey as well. So thank you so much for your time. And then our last webinar in the Fall 2020 series is called Frontline Workers, and it will be about nursing experiences during the pandemic and beyond. And that one will be presented by Amy Swales and Laura Burnham. And without further ado, I'm going to hand it over to Trish MacEnroe, who's here. Trish is the Baby Friendly USA Chief Executive Officer and is also the chair of the Central and Eastern European Countries and Independent States Baby Friendly Hospital Initiative Network of Industrialized Nations. And then Ms. Tammy Titus will also be helping with questions at the end. And she is the Baby Friendly USA Clinical Director. So thank you so much. And without further ado, I will hand it off to you.
Okay, thanks so much, Maytal. It's a pleasure to be here. And I join you in congratulating the baby-friendly hospitals recently designated in Mississippi. I join you in congratulating all of Mississippi for the incredible work that has been accomplished there. So thank you, CHAMPS, for your amazing contribution to the state of Mississippi. And thanks to all the hospitals that stepped up to the plate, answered the CHAMPS call, and really got to work to improve practices to support mothers and babies with their breastfeeding goals. It's a remarkable story, and it's just really exciting. So congratulations to you all. And just, you know, as I want to give a shout out to all of you who are working in the hospital right now, providing direct care to mothers and babies. I cannot imagine how challenging it must be for all of you in this COVID environment. COVID's been crazy for all of us, but you've borne the brunt of the impact of COVID-19. And thank you for continuing to provide excellent care under such challenging circumstances. We are very grateful for the work that you do. And know it's very difficult. You know, as COVID has impacted all of us, and it's impacted Baby Friendly USA as well. And obviously you want to hear the results of some of our thinking in terms of how we're responding to the pandemic and how we're going to keep moving forward in this situation as well to carry out the work that you would like us to carry out. So I'll start off with just a little bit of an update of some of the things we have done. I think when COVID really started to hit this country, I personally was in a little bit of denial in that recognizing the severity and probably the longevity of what was going on. We had already had 60 assessments scheduled and many request letters for on-site assessments. And we boldly, in March, canceled 2 weeks worth of assessments. And then a week into that, we boldly canceled another 2 weeks and then realized we had to cancel out to May. And of course, you know, we're now looking at the long haul of what COVID means to all of us. And so we quickly adapted our practices. We knew that, hospitals were most significantly impacted by COVID. And one of the first things we did was organize Tammy and her team to conduct a series of practice update calls with hospitals that were scheduled for assessment or had submitted their letters of invitation asking us to come on site to do an assessment. And at the time all those letters were submitted to us and hospitals were ready to go and wanting to have an assessment. And we know COVID had a significant impact on the way they did business, and it impacted you all right overnight. And so before we move forward, we wanted to hear a little bit about what happened in your units as a result of COVID. So through March through the end of August, between March and August, we conducted 94 practice update calls. First, March through June, we wrote the script, we learned what we wanted to write, learned from you all, and then the actual calls took place from June through the end of August. And we had fabulous conversations with so many of you, learning how creatively you responded to the pandemic and worked hard to keep the 10-step practices in place. So kudos to you for all that you did during that time period. Following the practice update calls, we knew we had to really think hard about how we were going to do business. Our primary business, as you know, is conducting on-site assessments, and we really had to think that through because it was pretty clear we weren't going to be able to go on site for a little bit of time. This slide just shows a picture of our guidelines and evaluation criteria. Hopefully you're all familiar with this document. This we posted to our website in December of 2019. We called our interim guidelines and evaluation criteria. And I put this slide here just to kind of make sure we all were starting from the same perspective. And that is that the purpose of the baby-friendly assessment is to evaluate the facility's maternity care practices for their compliance with the most current version of our guidelines and evaluation criteria. So one, I wanted to make sure you knew what our most current guidelines and evaluation criteria looked like. These are available on our website. Our website is www.babyfriendlyusa.org. I'm sure you're all very familiar with that. But you'll find the website, the guidelines and evaluation criteria are publicly available on our website. So as you can imagine, the assessment of baby-friendly criteria were designed to be conducted on site. So much of the breastfeeding experience really requires interpersonal interactions, and it makes sense for us to be there on site to evaluate those practices. But as the pandemic worsened throughout this country and the reality of what we were facing, we knew we had to rethink how we might go about conducting our assessments. And we concluded that our best way forward was to create a hybrid assessment. This is just a quick statement here. So the rest of our presentation really today is focusing in on the hybrid assessment process. So in our hybrid model, the first part will be conducted virtually. And the second part, as you see, we say is planned to be an on-site assessment. And I'll tackle the question that you're all probably wondering right now. When will we be able to go on site, and what is that all going to look like? And given how the COVID continues to spread throughout this nation, looks like cases are spiking again. We are beginning to think about how do we conduct part two? And is there another way that we can conduct part two, given the fact that we're likely to have travel restrictions in place for a period of time? So we don't have any firm answers yet on how part two is being conducted, but I do have some great answers about how part one is being conducted. And today we are conducting our third virtual part one assessment. And the first two went through beautifully. We were excited with how well it went. The facilities were really excited with how well they went. And so I'm really happy to say that so far, so good. We've been able to avoid some glitches. So we're excited about what I'm going to present to you today and feel that pretty confident that the plan is going to work well for you as well as it has worked for the hospitals we've assessed so far. So one of the things, as we planned the virtual assessment, it took us quite a bit of time to think through every detail of this process. And we tried to think it through from what do we need to do to be successful on our end, and then what do we need to do to be successful, what do we need hospitals to do to be successful on your end? And so one of the things that we identified early on that integral to the success of the hybrid assessment would be the appointment of a team leader. Each facility should select their own team leader, and that person is responsible for making sure that everything runs smoothly before and during the assessment. Now, your team leader could be what many of you know we call our primary user of the portal. Could be the primary user, or could just be another person who's just really organized and great at keeping things moving. The primary task of the team leader, as we see it, is that this person is responsible for ensuring that all required materials are uploaded to the portal in the appropriate subfolders using links that we'll provide you. And I'll be talking about those links and how to upload materials later on in the presentation. So this is just an overview, and some of this may not make sense at this moment. But so the team leader provides, uploads materials to the appropriate subfolder to the links provided by us. This person is also responsible for working with the hospital IT department to ensure the facility has all the internet and video conferencing capacity necessary to conduct the assessment. They're responsible for ensuring that selected individuals for interviews have access to the equipment with internet and video conferencing capabilities. They are responsible for working with the individuals that have been selected to have an individual interview, nurses and healthcare providers. And again, we'll talk about which interviews we're going to be doing in just a moment. They need to be ready to respond to any last minute glitches that may be happening at the hospital level or issues that they need to address, and reserving a room and organizing materials to make sure that the interviews and the assessment go smoothly. And so we have created a whole series of forms. It seems like we do love a lot of bureaucracy here at Baby Friendly USA. So we've created a whole variety of forms that we send out to a hospital prior to the assessment. And it's on one of those forms that the hospital will provide information to us about who the team leader is and how we can get in contact with that person. And then we'll continue to communicate with that person throughout the whole planning process and help that person be successful in pulling together all the materials they need for getting ready for the assessment. So it's really just a transition slide. We can just move on to the next one. So this slide lists the primary activities that will take place over the 2-day interview. So during the part 1 of the assessment, we will be conducting the administrative interview. And we'll talk about that in just a few moments. It's typically conducted in a group format. We will also be conducting the purchasing agent interview, and it is during the interview where we will be looking at proofs of purchase of infant feeding products at fair market price. We will be conducting the healthcare provider interviews, the nursing staff interviews, and also conducting the materials review. So starting back up at the administrative interview, as I said, this is typically conducted in a group format. And the people that are included in this interview are members of the facility's multidisciplinary baby-friendly team that helped do all the work to get your facility to this place. We also include the CEO or other senior administrative staff members, the nursing director, the nurse manager for maternity services, the staff training coordinator, the nurse manager for prenatal services, and your prenatal patient education coordinator, as well as the team leader would be a part of this interview. So at the beginning of the interview, our assessor will introduce, and I'm going to say herself, because at this moment, all of our assessors are women. So the assessor will introduce herself and ask the group to go around and introduce themselves by name and by role. We have an overall plan for the 2-day period of time. So the assessor will then go over the draft schedule that we've prepared and sent to you and make sure that there aren't adjustments that we need to make to some of the timeframes that we had proposed. And we'll probably have had some conversation with you prior to the administrative interview if you do need to make some adjustments to those timeframes. After we go over the logistics for the day, then we actually have a series of formal questions that we ask during the administrative interview. And typically those are questions that align with items on the guidelines and evaluation criteria that says the nurse manager will report. So anything that is aligned with that, that's going to be a topic area that gets addressed during the administrative interview. And then at the end of the interview, our assessor will be announcing the names of the healthcare providers and nursing staff members who've been randomly selected for individual interviews throughout the rest of the assessment. So we'll bring the administrative interview to a close. It takes between an hour to an hour and a half to just cover the logistics, ask the questions, as well as announce the individuals for interview. So we will then give the team leader a little bit of time to go organize the individuals who were selected for interview. And then our assessor will move on to conduct the purchasing agent interview. It's during this interview, as I've already mentioned, that we will review the items that were randomly selected for the infant feeding product items that were randomly selected for further review. And I'll be providing a little bit more information about that in just a few slides. And then once we've completed the administrative interview and the purchasing agent interview, the remainder of the next 2 days will be conducting the healthcare provider interviews, the nursing interviews, and then going over all of the various materials that have been submitted to us for review. So let's talk a little bit about the technologies that we're going to be using. And it's fairly simple, really easy to use technologies. We'll be using Microsoft platforms. So we'll be using Microsoft OneDrive for the materials review, and I'll talk to you a little bit about how to upload materials to Microsoft OneDrive when the time is right. And then we will be using Microsoft Teams for all of the interviews. We've been talking with some IT departments about those, if they're not software that you are using, how we're going to work with you to work through those glitches. And really, you're going to be accessing those technologies through our software licenses. You don't have to download those to your own devices. So I think we should be okay. We've not had any difficulty with using these technologies in the past. Looking at Microsoft OneDrive, we're going to use that for uploading documents for the materials review. So how that's going to work is that the hospital team leader will receive an invitation with a link from a generic email that we have set up called Virtual Assessment at babyfriendlyusa.org. And so you'll receive an invitation to share documents. And we have set up 4 facilities. Each facility will have its own folder in our OneDrive account. And each facility's folder will have 4 subfolders. The 4 subfolders are infant feeding policy, patient education, staff training, fair market price, infant feeding products. So the team leader will get an invitation to each one of those subfolders. And then the purchasing agent will also get an invitation to the fair market price infant feeding products subfolder. And then the way the team's interviews will be set up is they come through calendar invitations through Outlook, inviting you to a Teams interview. So I'm going to show you examples for all of these items in just a few slides. But before we do that, if we move to the next slide, there's a few key planning documents that I'd like to talk about. tell you how you'll get these planning documents. So the two documents that are featured on this slide provide you with guidance to help you prepare for the part one of the assessment. So on the left side of the slide, there's a document, and you're probably all kind of familiar with our crazy naming convention for materials. It's when you look at it in the portal, it'll say DESIG or DESIG 7-1E, Hybrid Assessment Part 1 Virtual Checklist. So this is a checklist of everything you need to do to get prepared for the assessment. And then on the right side is a document that's titled DESIG 8-1E, Sample Hybrid Assessment Virtual Schedule. So as the name suggests, it is a sample schedule. We thought it was helpful for us to think through the organization of the day and the order of business and how much time we needed to give the team leader to go away from the assessor and organize other things and make sure the assessor had tasks to do, so that we continued to keep the assessment flowing in a very organized way and efficient way that allowed us to get the work done in the time frame that we promised you. And then as the hybrid assessment part, the virtual checklist, as I said, it has pretty much everything you need to do to get ready for the assessment. And I'll talk a little bit more in just a moment about how you get these materials. And it just introduces the assessment scheduling process. So the whole process begins with the submission of assessment request letters. And I'm saying plural because there actually are 2 letters that we ask you to submit. And we provide you with templates for the letter of invitation that specifies all the items that we need in place in order for us to conduct the assessment. So what we're requiring is there's an on-site assessment request letter, and there's a hybrid assessment part 1 request letter. And you receive both of these letters either through the readiness assessment interview that you have in the latter parts of either D4, or if you're a redesignation hospital, in your redesignation year 1, you engage in a readiness assessment interview with a member of our clinical team. So you get those letters either through the readiness assessment interview, or if you had already been through that process when COVID-19 struck, you would get these letters also through the practice update calls that we provided post-COVID and pre-scheduling of your assessment. The reason we're asking for both letters is really just for efficiency's sake. What's needed for an on-site assessment is slightly different than what is needed for the virtual assessment. At some point, we're going to go back to the on-site assessment, and if we have both letters on file with you acknowledging all the things that you need to have in place for one or the other, it just will make the next steps flow a little bit more smoothly. So once we receive your on-site or your assessment request letters, we will acknowledge the receipt of these letters with an email sent to the team leader. And it's in that acknowledgement email that we send to the team leader that we're going to send you the DESIG 7 Hybrid Assessment Part 1 Virtual Checklist. So that'll be attached to that email. And following that initial acknowledgement, the team leader is going to be receiving a series of follow-up emails. So you'll get the acknowledgement. That will be followed by an offer of dates for when we will be able to conduct the assessment. And then we will provide you with another document called the assessment overview, as well as a document, the sample schedule. That will be followed up with individual invitations to upload materials to the 4 facility-specific subfolders. And then the purchasing agent will also receive an invitation to the fair market price subfolder, as well as getting information from us on fair market price the toolkit guide and the various forms that go along with preparing for the review of infant feeding products. This is a sample of the fair market price on-site assessment preparation grid. We have decided that for the virtual assessment, we won't be requiring every infant feeding product to be uploaded to the subfolder. We are going to be conducting a random sample. We're going to be looking at a random sample of your infant feeding products and proofs of purchase. So how we're going to be drawing that sample is when we send the team leader and the purchasing agent the invitation to the fair market price subfolder, we're also going to be sending the fair market price toolkit and this on-site assessment preparation grid. When you receive the on-site assessment preparation grid, we're going to ask the team leader and the purchasing agent to work together to prepare a list of all the infant feeding products that are purchased by the facility, put all of the items that you purchase on this grid, and I didn't show the pages for which, but there is space. It doesn't look like on this sample first page that there's room for you to add all the infant feeding products, but there is on subsequent pages, and we ask you to put them on the grid in accordance with categories, and then email this grid back to us. We will do a random selection of infant feeding products, and it is those infant feeding products that were randomly selected for further review that we will need to have you upload invoices and proofs of purchase to the infant feeding products subfolder. And so this is just a transition over to how the whole materials submission process will work. So as I mentioned earlier, and there's so much information, I am repeating some of it intentionally, so it will stick because there's so many details, and what I've learned in Baby Friendly is details really count. So as I mentioned earlier, each facility will have its own folder in our OneDrive account, and each facility's folders will have 4 subfolders, and those subfolders are the fair market price infant feeding products, the infant feeding policy, the patient education materials, and staff training materials subfolder. So only the facility team leader may upload materials to all subfolders. The purchasing agent will also be able to upload materials to the fair market price infant feeding products subfolder. And then once you have uploaded all of your materials to the subfolder, we will keep access to that folder open through the completion of the assessment. But once the assessment is completed, we will remove your access to that folder because we are only able to review materials submitted prior to the end of the assessment for that assessment. If something should have been reviewed, we'll have another process for dealing with that then, but we'll only review things that are in the folder up through the end of the assessment. These next couple of slides are just going to give you an example of what you're going to see when we extend invitations to you to upload materials to the folder. So what you see on the screen is an example of some of I took some screenshots of what it would look like. So as I said before, the team leader will receive a separate request for each of the 4 folders. And you'll see in the example on the left-hand side, Anita Paley sent you a request for fair market infant feeding products with this message. And you'll see a blue button in the middle of that white field, and it says upload files. So all you need to do is click that upload files button, and you will be given the option to choose any files from your computer that you would like to choose and upload to the fair market price infant feeding product subfolder. It's really quite that simple. One helpful hint that I'm going to give you is that you do need to keep a list of all the materials you've uploaded to each folder because they're not visible to you after you've uploaded them. They're visible on our end, but they're not visible on your end. So just an important tip. So once you have uploaded the files, you will be able to access this upload file link multiple times. You can just keep adding folders by clicking the same link. And then when you're finished with uploading your files, you click the upload file link again, and the materials be inside our OneDrive folder. And what you will see is just a confirmation that you've uploaded materials to the fair market price infant feeding product folder. So it's a fairly simple process, a process that we've all gone through with other software a million times over. Just wanted to see how it would work here. This just shows the behind the scenes view. Once you've selected your files and click save, you get a pop-up window that's shown on the slide and confirms that you've added the slides. So when you're finished adding files, just enter the first and last name of the person that uploaded the files, click upload, and then your materials are securely in the folder that you've uploaded them to. And then you get that nice reinforcing message that your upload was successful. I always like it when you get those nice messages. We don't always get positively reinforced in the things that we do. So nice that Microsoft reinforces your success. So let's move on and we'll talk about interviews. So this is just a little transition slide to move from one to the other. How we'll be conducting the interviews is through Microsoft Teams. So here are just some of the basic requirements that we have for conducting the interviews. So clearly you need to have computers with video conferencing capabilities, and it's simply a camera and a microphone. I'm judging that since you're all on this call and it's a video conferencing call that you have computers with this capability. Clearly, I'm sure know by now, this is so routine that you need an internet connection. But we do have a few ground rules that we need to put in place. You may not record the interviews, and we will not be recording the interviews. We'll be face-to-face with your staff and video face-to-face with your staff, and we'll be writing down their responses, but we're not recording the interviews, and we ask that you not either, for the integrity of the overall assessment process. We also will not allow guests or members of the press to be present. I'm sure that's a no-brainer from your end, but it's important for us to mention anyway. The way the interviews will work is that the facility will receive a calendar invitation from Baby Friendly USA. And the calendar invitation will have a link to the team's interview. For those of you who work using Outlook, the calendar invitation will look like every other calendar invitation that you get from Outlook to Outlook. So I didn't think I needed to put an example of what a calendar invitation to Outlook looks like, but I did think that that if you weren't familiar with calendar invitations to a non-Outlook account, that it might be helpful. So here's an example of what it looks like to get a calendar invitation from Outlook to a non-Outlook account. So I invited myself to my personal Gmail, and this is what it looks like here. You'll get a meeting title on the invitation. It will clearly state the type of interview it is for. So the titles that we'll be using would be BFUSA Administrative Interview, which is what you see on the screen here. We would use BFUSA Purchasing Agent Interview and BFUSA Staff Interviews. And then the way, if you're not familiar with Microsoft Teams and how it functions, if you look at the link on the bottom of this screen here where it says Join Microsoft Teams Meeting, that's actually the link that you will click on to access the meeting. You won't need to download Microsoft Teams to your computer. You should just be able to access Teams by clicking on that link. But it is a little bit confusing because the Teams link looks a little bit different than most other GoToWebinar or Zoom or some of the other technologies. You think they would standardize these links and make it easier for all of us that are juggling multiple technologies, but they don't. So that's what the Microsoft Teams link looks like. Just as a review, we're going to typically start the assessment with the administrative interview. And when I say typically, it's every so often we need to make an adjustment because of an event happening at the facility, and we're generally able to make some adjustments to the timing of the various activities during the assessment. But it makes sense to start off with this interview. So, and it typically occurs in a group format with all parties in the same room. And so for the assessments that have been conducted so far, that is the method that the hospitals have chosen to follow through with. They have one computer, they put the screen up, and everybody can participate via a computer in a conference room. But we do acknowledge that you may have some either social distancing requirements or infection control requirements that mandate each person to participate from their individual offices. And we are able to accommodate if that's the case for your facility. But if that is the case, we will need the email addresses of all the people that are required to participate in the administrative interview. And we have a form to collect all that information from you. Go figure. So we'll just need you to send us that information via the form that's listed on the screen, and we'll send out individual calendar invitations for the administrative interview if necessary. And so the next task for interviews will be setting up the individual interviews. And so thinking about the healthcare professional interviews, prior to the assessment, the team leader will need to upload a roster of healthcare professionals and nursing staff members to the facility specific staff training subfolder. And at the end of the administrative interview, our assessor will announce who she has randomly selected from that roster to conduct the individual interviews with. We also understand that conducting the individual interviews may pose some logistical problems or challenges for the facility. We think the simplest way to proceed is for the facility to set up a single interview room equipped with all the items that are listed on the slide. And then if your infection control procedures will allow for this to occur, we can send one calendar invitation to the team leader to set up the interviews for the day and just keep teams activated, and staff can come and go as they need. We know that even though the assessment will be underway, you will all still be actively providing care to patients. And if you're responsible for patient care, you can't always make yourself available at a specific time. If at that time you're providing care to the patient, you need to stay with your patient and finish it up. And so we've always had some flexibility in the way we've conducted our staff interviews. And so if we are able to set it up in one room and keep the Teams link open all day long, that allows for that flexibility on your end. So that allows for the greatest amount of efficiency. But once again, if infection control procedures at the facility require individual interviews to be conducted from individual locations, then we'll need the email addresses of all the people who are randomly selected for interview, and we'll have to set up individual calendar invitations. So it's a little bit trickier because sometimes, I'm sure you know that internet connections don't work well in every individual office, and so again, it can be challenging, but we will accommodate it if it's necessary. So in addition to the room being equipped with all the items that are listed on the slide, the prior slide, it just is really important that the interview room is in a quiet area that allows for privacy and confidentiality of the responses. And I think it's important for two reasons that this be able to be accommodated, because individuals are going to feel awkward and nervous. And so we want to have them have privacy. And of course, we need confidentiality of responses so that we can have integrity and honesty in responses. But we also want to make sure that other staff member aren't overhearing questions and answers, because we want to have an honest assessment of each individual's knowledge and understanding of the practices that you've worked so hard to put in place. And into kind of the last segment, which just kind of goes over an approximate timeline. And this is just sort of an approximate timeline. It's not exact, but it just kind of lays out the tasks in a way that just kind of will help you organize things. So approximately 7 weeks prior to the assessment, we will acknowledge the receipt of your assessment request letter and send you the virtual assessment checklist. So that's when I say approximately, it may happen a little bit more. It may be many more weeks out if we're booking. Right now, we are booking assessments into December and January. So it's a little bit more than 7 weeks. We may have an assessment slot available in November, so it might be just right at the 7 weeks mark. So a lot has to do with your availability and our availability and how that matches out. So when I say these are approximates, it really kind of aligns with all of our availability. So still 7 weeks out is when we, just after acknowledging your assessment request letter, we are going to send you an offer of dates. And we will send you 2 documents. One will be the assessment overview, and that's a document that you will use to communicate, key email information to us. You'll let us know about whether or not you're able to do interviews in group format, or if we have to send individual emails out to folks, etc. So that's what that overview is all about. We'll also be sending you the sample schedule. So that you'll get an overview of how the day is going to look, and you'll be able to assess whether or not that works at your end, if we need to tweak and make some adjustments to that. And then in the 7th week prior, you'll also get the follow-up emails where we provide the fair market price preparation grid and toolkit, as well as the request to upload materials to the 4 facility-specific subfolders. So in the weeks 5 and 6 prior to your assessment, here's where the team leader and the purchasing department will work together to complete the on-site assessment preparation grid. And we just didn't change its name. We know we're not doing it on site. We just didn't change the name. So the F&P prep grid. And we're asking you to include all the infant feeding products prepared by your facility. And you can refer to the toolkit for guidance if any questions about what products to include. And then you're going to email this grid back to virtualassessment@babyfriendlyusa.org within 2 weeks of receiving it from us. And then in the 5th week prior to your assessment, we will randomly select a sample of products by highlighting the selection and providing notification to the primary user that's identified by the facility. And then upon notification of the items that have been selected, randomly selected, then it's your job to then begin to gather all the invoices and proofs of purchase that are needed for the assessment. Just as a reminder, you're required to provide 3 invoices for each of the selected products. So we need one from each of the 3 most recent months that you purchased a particular product. We know you don't purchase every product every month. There are some products that you use more regularly than other products. We just need your 3 most recent invoices and proofs of purchase for all the items that are selected on the on-site assessment preparation grid. And then the team leader and purchasing agent should work together to upload those materials to the fair market price subfolder. This just is a reminder of what are the acceptable proofs of purchase for infant feeding products. We need either canceled checks, we need a copy of the front and back, an ACH transaction receipt or a screenshot of the ACH transaction, bank statements. Some of you are really small and do such a great job promoting breastfeeding. You only buy your formula retail, and so you might just have retail receipts. That's okay. Those are all acceptable proofs of purchase. So once you have collected all those proofs of purchase, You want to make sure you upload all of those items to the appropriate Microsoft OneDrive subfolder. So, and that should be happening in the weeks 3 through 5. Also during those very busy weeks, that's the time where you're going to be uploading all the other required materials to the subfolder. So your most currently reviewed infant feeding policy, or if it hasn't been reviewed, if you've made any updates to the policy, we need to have those highlighted so that we can have our assessor look at that on site, or excuse me, virtual on site. We need you to upload your patient education materials and all your staff training materials, so that those weeks 3 through 5 prior to the assessment are sort of a busy time period. 2 weeks prior to the assessment, you want to begin preparation for the staff interviews. So you're going to want to look ahead and see which staff members, which nursing staff members and healthcare providers are scheduled to work on all shifts of the 2 days of the assessment, and begin to organize that information into a roster. Probably at that time, it's a good point to catch their emails if you know you're going to have individual interviews, invitations set up to do interviews. Probably good to capture that on that roster at that particular time. 1 week prior, upload that roster to the staff training subfolder, as well as just double check and make sure that all the other materials are uploaded to the folder. So that's it. Our last slide is just, we wish you the absolute best for a successful assessment. We know you work so hard to get to this point. We appreciate everything that you do to improve the care you provide to families. And we really always hope for you to be successful in achieving baby-friendly designation. So I'll stop there. I think we've left a few minutes for some questions. We'll let you chime in, Maytal.
Thank you so much for that wonderful presentation. Really quick before we take questions, we just wanted to share a little bit about our CHAMPS mock virtual assessment and just show kind of
Sure.
How that's going to work for us as well. So CHAMPS has always done a mock assessment with its hospitals to help them prepare for their on-site assessment with Baby Friendly USA. And so in light of Baby Friendly USA switching to a virtual format, we have also done the same. So our mock virtual assessment will be 1 day, and similar to the Baby Friendly USA, part 1 of the hybrid assessment will include staff interviews and a document review. Those are going to be the main components. And yeah, this virtual assessment kind of fulfills the same role, we're hoping, as the virtual form of the Baby Friendly part 1 of the hybrid. So our timeline is that you'll request and schedule a mock virtual assessment with CHAMPS through your CHAMPS team hospital coach. Then we'll have a prep workshop, and the hospital team will have a list of action items, including documents to prepare and upload, and various other tasks to complete prior to the day of the assessment. Then we'll have the CHAMPS mock virtual assessment, and then the CHAMPS team will write up and share a mock virtual assessment report with the hospital that the hospital team can use to identify challenges and create an action plan for necessary changes and prepare for their virtual assessment with Baby Friendly USA. And we, for our mock virtual assessment, are going to be using Dropbox for our main hub. So after the mock virtual assessment prep meeting, CHAMPS will follow up with an invitation to a personal Dropbox folder for the hospital lead and team and outline exactly which documents to share. Then comes the day of the mock virtual assessment. On this slide, you can see screenshots from one of our mock virtual assessments. And we are conducting them via Zoom. And the agenda for each hospital will be a bit different depending on the availability of the staff for interviews, but all the virtual mocks will take the same basic form with an opening morning meeting, followed by a documents review and simultaneous staff interviews, and then a wrap-up meeting at the close of the day. And then for follow-up, the CHAMPS team will write up a report for the hospital that details our findings, including areas that meet and don't meet Baby Friendly USA requirements, and share this report with the hospital team. And then the hospital team can work with CHAMPS to discuss the report and to create plans for any areas in need of improvement. And really, the CHAMPS team is just here to help you all in any way that would be helpful for you, so that when the day of the hybrid assessment part 1 with Baby Friendly USA comes along, as Ms. MacEnroe so graciously told us all about just a few moments ago, you all feel very prepared. Now we'll move on to questions. If anyone has any questions, you can type them in the chat box, or just unmute yourself, or put yourself on video and ask questions.
So, and I'll just chime in. Someone did ask a question. What order are the files read once they're submitted? We do leave that up to each individual assessor to make the determination. But it was suggested that if a facility wants us to read the materials in a particular order, should we number the files? And that's exactly what we do. Like, you notice, like, does it 1, 2, 3, 4, and so I think that's a really logical way, because I would think most likely our assessors will just choose to read the materials in the order that they appear in a particular subfolder. So I think the numbering is a great idea. So nice suggestion. And we'll pass that along to the assessors to let them know that if something is numbered, that's a good indication that the hospital would like it read in a particular order, that the materials lead one into the other.
Hey, hi, this is Laura from CHAMPS. I have a question for you, Trish.
Hi, Laura. Hi, Laura.
So I was just interested when you say that you'll select a sample of products that the hospitals will provide invoices and proof of purchase for. How large is that sample? Like, how many items will it include?
Yeah, so probably I have to look at the guide. It's in the fair market price toolkit, but I think we said up to 25. We know hospitals have like hundreds of products that are purchased. I think we'll have we have parameters, and I didn't look up the specific.
That's right. That's right, Trish.
Is that right, Tammy? Okay.
Yes.
Thanks.
Yes.
Great.
Oh, thank you.
Good question. It's a lot to upload, so we felt that it was time to move to a sample. So we know the burden of the virtual assessment on everybody. Like, this has been a radical change for all of us, and so we were trying to reduce the burden where we could, but still be honorable to the assessment.
And then would it be just a follow-up question? I guess that you would just need like 25 separate files for like one file for each item.
So, Tammy, did Vanessa say how they were uploading them? I hadn't. It's the more organized it is, the easier it is. So yes, it would be 25 files if that is 25 items. But depending on how you get invoiced, some hospitals, as you know, are buying all their infant feeding products through purchasing groups, or they buy in quantities. So it might be multiple products on a single invoice. That's fine. Multiple proofs of purchase on the same, as long as the proof of payment aligns with the invoice, and there's multiple products on the invoice. That's fine. Just make sure all the items selected are covered by the invoices. Does that make sense? And Tammy, if you want to add to that.
I think it makes sense, but I think it's like can get very complicated. Just knowing, like, having looked at different hospitals' invoices and proofs of purchase.
Yeah. Yeah. It's our favorite part too, don't worry.
and just so that if you realize that last column on the on-site assessment prep grid, that's where our assessors will kind of try and sort that out, because it probably will look different for each facility, what files are uploaded. And so they'll probably have to just work through there and just kind of keep checking that off and kind of work with whatever works with each facility.
And I know you're all recording this. We have recorded this, and it's on our portal for those hospitals that are in D4 REDES. So it's also available through us. So hopefully there's some reinforcement. And, if you don't think of your questions now, that was a ton of information to share. Like, I feel like this work is death by detail, isn't it? like so many things to pay attention to. And it's hard to absorb it all. So, you know, if you have questions later on, we're glad to answer them. Well, I'd like to thank you all for the hard work you're doing. And thank you so much, CHAMPS, for organizing all the things you organize, all the helpful webinars for everyone, and all the coaching that you're doing and support for hospitals. It's really invaluable. And we're appreciative of your work, and we're so appreciative of all the change that you're going through at the hospital level. And thank you for the amazing work you're doing and the great care you're providing to moms and families.
Well, thank you so much. It is about 2 p.m. Eastern time. And just we really value all the time that you've taken in creating this presentation and sharing it with all of us, and everyone taking the time out of your very busy schedules to join us on this webinar today. And hopefully we will see you again in 2 weeks for our next webinar, which again is CHAMPS COVID-19 Survey 2 results and next steps in Mississippi. And this will be presented by Dr. Ann Merwood and Paige Beliveau. Thank you so much, everyone. Have a great day.
Great. Thank you. Have a good day.